What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on Tuesday, October the 26th. Pleasure to have you with us. October is Good Dental Health Month, and I have Dr. Philip Batson with us today from Columbia Healthy Smiles. We're missing Dr. Elizabeth Abe. She's back manning the office today, right?
She is, yes. She sends her warmest regards.
All right. Now, October is Good Dental Health Month. Yeah. What are some of the things that we need to know about that? And then we're going to talk about Halloween and Halloween candy. So the purpose of Good Dental Health Month is what?
Just to keep it on the forefront of people's minds, stay on top of their oral health or oral hygiene. And so with good dental hygiene, we just want to remind, just doing the standard things at home that can really just pay off in the long run. Brushing twice a day for 2 minutes each time, flossing nightly, daily, using of watching how your sugar intake, how much sugars and sodas and things like that you're eating. I know, like you said, October, with Halloween coming up. That's
why is it that some people, it's the same thing with your health. Some people can eat whatever they want to eat and they have no problem. They eat all the fat and the fried food, no heart attacks. Same thing with dental health. Why is it some people can eat all the sugar and they don't take care of their teeth really well, but they have no cavities? Other people who are diligent about taking care of their teeth end up with cavities. Is it the makeup of our mouth?
Partly, yes. So, what you put into your mouth is just part of the equation to, what will affect your teeth, potentially what could cause cavities, things like that. The other factors in play could be, what is your oral environment like? Do you suffer from dry mouth? That can be very taxing on teeth and cause cavities.
Dry mouth can?
Dry mouth's very, very detrimental to teeth, and I kind of equate it to if your mouth is a car wash, and when you take your car through the car wash to wash off all the dirt, there's lots of water in there. It's washing off all the dirt along with soap. But think if you took a dusty car through a dry car wash, nothing comes off your car. If your teeth have plaque on them and build up on them and your mouth is dry, that's just going to stick to your teeth, and that just allows a great place for bacteria to go to and cause decay.
So how do you avoid dry mouth? Drink a lot more fluid?
Dry mouth can be related to medications people use. Some medications cause dry mouth, so people who are on a lot of medications sometimes suffer from dry mouth, and so really encourage them to always keep a bottle of water with them. Some people have health conditions that cause dry mouth that they always need to keep water with them. Something like a disease, autoimmune disease called Sjogren's syndrome, causes dry mouth, and so patients who suffer from that always need to keep water with them. We sometimes put patients who have a chemo radiation, to the head and neck region. That can then cause dry mouth if it's affected the salivary glands. So patients like that, we can put in fluoride trays, to wear with high concentrations of fluoride to help fight the dry mouth and keep the teeth as healthy as possible.
And some people don't realize how important those regular 6-month checkups are. We go to the doctor once a year for our yearly checkup, but it's important to go to the dentist every 6 months to have those your teeth clean.
Yeah, and teeth.
Why is it that the teeth have to be cleaned professionally, even if you brush and floss every day?
So just over time, that plaque that can build up on your teeth, the soft stuff that your toothbrush bristles can wash away, can calcify, and that is what becomes tartar. And what we call, and the other term for it is called calculus. Once plaque hardens on the teeth, toothbrush bristles, floss, water picks aren't going to get rid of it. So those professional instruments that the hygienist uses when you go in, that can break off the plaque off of the teeth because it is literally calcified onto the tooth surface. And so getting rid of that buildup is key.
Okay, let me just ask you a hypothetical question here. If you go to the dentist and you have your teeth cleaned professionally, and then you religiously floss and brush and water pick, is it possible to keep that plaque from building up? Or in 6 months when you go back, are you still going to have plaque there?
It's possible. It is possible. I would say there are so many kind of nooks and crannies, places where even if you brush really well, think you're hitting all the angles, you may not be able to reach all the angles perfectly, and when somebody has like a hygienist who's sitting behind you or to the side, has a different angle to look and get instruments on that you can't reach when you're looking in the mirror.
I know, because I religiously floss and water pick and brush with an electric toothbrush, and I thought, wow, there's not going to be anything to clean when I go in there. I go in and she goes, yeah, you got some down on the bottom there that we gotta scrape off. It's like no matter what you do, you still have to have your teeth cleaned professionally.
Absolutely, and that's the most common area where you just mentioned down on the lowers.
Yeah. After I got that, your dad talked me into getting an electric toothbrush, and after that, I thought there's not going to be anything that has to be cleaned anymore. But it's still there.
But it's less work for the hygienist now.
Yes, it is, and it feels better too.
Yeah.
All right, let's talk about Halloween candy, because Halloween's coming up here real soon. What do you say about that?
I say, if you enjoy the day, enjoy the time with your kids, with the candy, just be aware of how much they're eating, how often they're eating it. Don't let them sneak away and eat it before bed or hide it somewhere, where that extended period for that sugar to sit on the teeth and where they're not getting them brushed, before bed. That's really key right there.
Okay. So if you eat candy, it's important to brush right away.
Absolutely.
Yeah, or else, as you told me the last time, you said, just if you can't brush right away, just take a swig of water and swish it around in your mouth and spit it out, and that helps break it up.
It does, yeah, and it kind of clears the sugar in the mouth. Whenever you put something in your mouth, you're lowering the pH in your mouth, so it's making it more acidic. And we just want to counteract that and make sure that acidity level is not staying really low for an extended period of time.
Okay. If people want more information, they want to talk to you or make an appointment, how do they get in touch?
They can call us at 573-875-7071 or go to our website at www.columbiahealthysmiles.com.
Right. And if, as I've mentioned before, if you have had concerns about going to the dentist because you're afraid it's going to hurt, it's not going to hurt. It's not going to hurt. They go through, I tell you what, I'm such a baby. The dentist, I ask them to even deaden my gums before they start cleaning. Their main concern is not causing any discomfort at all. Okay? So give them a call. Thank you, Philip. It's good to have you here.
Thank you.
We'll see you tomorrow. pepperpmissouri.edu. Something you'd like to hear or see. Bye-bye.